We know that patients who have primary melanoma, between 3 to 10% of those patients will develop in-transit disease or recurrent disease. And we often ask the question, well, what do we do with that? Often, if this is just 1 or 2 small lesions, surgery is still the main treatment for that. They will resect those in-transit lesions out. But we know that the risk of the patients recurring is extremely high. So lately we've started asking the question, is there anything that we can do to really try to prevent the patients from recurring? So one of those mechanisms that we're looking into is really doing neoadjuvant studies. So these are studies before we do surgery to try to activate the patient's own immune system to prevent the melanoma from recurring. One mechanism to do that is to use oncolytic viruses. And we know that from the OPTIM study, which was a phase 3 randomized clinical trial in which we used Delimigen Laherparepvec, also known as T-VEC. We know that from that study, in patients that had early disease, the patients with stage 3B and 3C and stage 4 M1A, it appears that T-VEC decreases the risk of those patients from developing visceral metastases. So we're now asking the question, can we then move that to an earlier patient setting? The OPTIM study was for patients with unresectable disease, but we're now asking the question, can we do this actually in patients that have resectable disease? And do that treatment before we do surgery to try to activate the immune system. So we're doing a randomized clinical trial at the moment in which patients are randomized to receive surgery up front, which is our current standard of care for resectable stage 3B, 3C, and stage 4 M1A disease, versus receiving T-VEC for 3 months and then undergoing the surgery. The primary endpoint for this study is recurrence-free survival. So we have almost full recruitment to the study, and this is sort of a new way for us to try to advance the field of melanoma care and also try to activate the patient's own immune system to prevent the melanoma from returning.